Okay, and now we're going to go to our program where we will have 3 short conversations between 3 cohorts of fellows, and we'll have one MAD fellow from each of the last 2 years together with the new fellow for this year. And so for our first grouping, we'll be talking about and exploring how design emerges out of the close attention to how individuals behave and interact at the scale of the body. And we will begin by inviting our new, and this panel will be made up of 3 fellows: CLEMENCE COUTEAU, a new fellow, Alexandra Reguer, a fellow this current year, and then Mariama Jai, a fellow from our first year in 2022. And so without further ado, we'd like to invite you up, and I think we'll present in that order. So over to you.
All right, I'm thrown into the deep end immediately. Hi, everyone. Thank you so much. My name is CLEMENCE COUTEAU. I'm a first-year MBA student at MIT Sloan School of Management. And I am really excited to be a 2024 Design Fellow. I'll just spend the next few minutes talking a little bit about my project for this coming year, which will be designing a digital solution to prevent postpartum depression. So I've worked in the healthcare industry for the last 7 years. And one of the central questions in my work has been, how can I design simple, accessible, and effective tools to change people's health behaviors, especially in low resource settings? I started my career as a Peace Corps volunteer in Benin, West Africa. And there I built health education programs, especially around maternal and child health. This is an image of the health center I worked at for 2 years with women lining up to wait for their babies to be vaccinated. And when I came back to the US, I became really interested in how digital tools can be leveraged for healthcare delivery. And so I worked at Amwell, which is a telehealth platform, and led a team that built a patient-facing chatbot to help monitor patient outcomes in between medical appointments. And now I kind of want to bridge those 2 things together and tackle one of the more pressing issues in the US today, which is postpartum depression. So 1 in 5 new moms in the US suffer from maternal mental health disorders like postpartum depression. And unfortunately, 85% of those women are undiagnosed and untreated. And even those who are diagnosed often end up on months-long waiting lists because of the shortage of mental health clinicians. And so when I arrived at Sloan, I was lucky enough to meet the founders of Nurture. They're here today, and they are trying to tackle this exact issue. First, they've already created a prediction algorithm which uses machine learning to identify pregnant women who are most at risk of suffering from postpartum depression using demographic information and past medical history. And as part of the MAD Fellowship, I'm really excited to work on the prevention piece, which will be designing a self-guided therapy chatbot to empower those women to improve their mental health outcomes before symptoms even arise. So the idea is to have kind of this educational chatbot be a digital companion for women throughout their pregnancy. We would enroll high-risk women right around the end of their 2nd trimester, and it would be with them throughout the rest of their pregnancy and even after birth. The idea is for the chatbot to be mobile-based and deliver bite-sized educational modules every day that help empower women to develop the skills needed to manage symptoms if they arise and proactively identify a support system. And this is based on a clinically validated protocol based on CBT, cognitive behavioral therapy. And I'm really excited to be able to research and test and hopefully deploy this tool in collaboration with 4 OBGYN clinics in the South Shore, and be able to interview mothers, women, clinicians to better understand their needs and test our prototype. And just to end on a couple more questions, because I think questions are really central to design. And throughout my project, I want to focus on understanding more about conversation design and gamification. So first, what tones, length, and frequency of chatbot messages might ensure easy digestion of the educational content? And then how might gamification techniques actually encourage the repeated and sustained interactions with the chatbot while still remaining really sensitive to the personal and serious nature of postpartum depression? So excited to dive into these questions and surely many more throughout my project. Thank you.
Hello, I'm Alexandra Riguer, and I'm part of the 2023 cohort. And so wonderful to be with the prior cohort and also the new cohort. And thank you all for being here. I'm a doctoral candidate in the MIT Media Lab in Todd Mackover's Opera of the Future group. And I am an interdisciplinary designer and mechatronic engineer, a cognitive neuroscientist by training, and a multi-instrumentalist musician. And my unique background and experiences converge to allow me to create unique designs and technologies to support patient healthcare from really anywhere in the world. And I'd like to start out today by posing a quick question, which is, how many senses do we have? So let's hold up some hands and let's see. There's some, I'm seeing all different types of answers. I'm seeing 5 senses coming up a lot. And so I see 6, someone might have a 6th sense there. We've got over 100. And in my research, I've been able to understand and explore and leverage these senses beyond the 5 to support patient healthcare. Just a few fun senses that maybe we don't always think about. If you know whether you're hot or cold right now, that's your thermoception. If you know that maybe I'm running a little long with my time, that's your chronoception. And if you know where your hands are in space without looking down at them, that's your proprioception. The human senses are a high sensitivity indicator of health status and how we're doing. As we've known a lot recently in the last few years, especially, changes in olfaction and taste can also indicate biological or neurological disease, but also differences in hearing can also reveal health and cognitive status. So by targeting the senses, researchers and designers and providers can also positively impact health. And that's because our senses are a bidirectional interface. So by measuring them, we can understand about health, but by also targeting them, we can promote health. And so this is where my work and my project comes in. And I design different omnisensory medi-musical devices to help rehabilitate different brain regions. I'm involved in a MIT MGH clinical study with stroke patients. Unfortunately, strokes are becoming even more common with some of the uptake of different viruses over the past couple of years. And right now, a lot of the patients are going home with tennis balls and squeeze balls. And I thought we could do better than that. And so it's been wonderful working over there with the clinical team and Dr. Ming Ning Ning, just to find better solutions for patients. And really innovating for efficacy and access and equity. So thank you so much.
Hello. Hello, everyone. I am Maria Majai. I am the first cohort of this incredible organization and being a MAD fellow. And so it's remarkable to see the generations that have passed. And so I want to start with why I do what I do. So what you can see here is a campaign that I ran in Lima, Peru during the height of COVID-19 2021. We're working to address the growth of domestic violence cases that were occurring and figuring out how can we do this within communities and centering those who were experiencing, but also the comunidades, I forget how we call them. Defensoras comunitarias were actually a cohort of incredible women who were leading this work on the ground. And our effort on my end was to be able to support and uplift this. This image is me in the kitchen in the back of a community hall in Houston, Texas. We're working to reduce the amount of kids that were being arrested on school campuses with the Houston Independent School District. And this was the first time that they had seen this kind of prototyping really quickly of after we leave this session, how do we as a team figure out what our working groups would be? And we then spent another year creating equity audits across the entire city. So you're probably wondering why I'm doing this in the first place. I was at Bloomberg Associates as a program manager on the social services team, where I discovered the IDEO.org Human Centered Design Toolkit, which I'm sure you all have, and have since then been dedicated to supporting this. So while I'm here at MIT as Morningside Academy for Design Fellow, I partnered with MIT GovLab. You'll see this is the only photo I have that showcases a case study that we wrote. It was an intergovernmental innovation for the federal government in Sierra Leone that was working on building an innovation lab. And what were the actual challenges for them to do this? So they took a human-centered design methodology, tried to apply it, and it was really freaking hard. And I think we need to talk a lot more about those challenges of how do we take frameworks that have been applied in one setting, but also make them more modular and more applicable. And so here I am today defending my thesis just this morning around the need for a more systems-carrying design on how we support those who are applying design in the public sector and inviting a lot more care and depth, whether it's within our team, within our communities, and across government employees. And so I look forward to diving into conversation shortly with all of us in our cohort around the conversation around bodies. So thank you.
We'll have a few minutes of group discussion, and then we'll open it to the floor for Q&A.
So I'll kick us off. We had a session before this where we kind of got to learn about each other, and a theme came up around how do we tackle challenges that are happening in society with a much more upstream approach. And so I'm curious for you, Clémence or Alexandra, what does it mean to take things upstream within your work?
Sure, I'll kick us off. So I've been working in public health for all of my career, and in public health, prevention is always seen as, in most cases, more effective than treatment. And so I think that's really key to the work I'll be doing with Nurture next year is trying to figure out preventative approaches, not just how do we treat postpartum depression, but how do we prevent it from actually happening in the first place? Because we see that most women get diagnosed usually at their 6-week postpartum appointment, but almost 40% of women actually miss that appointment. So women are falling through the cracks, and then those who are diagnosed often have symptoms that are difficult to treat at that point. Depression is associated with avoidance, and isolation. And so how do we actually get ahead of that and empower women to change how they, perceive pregnancy and motherhood before it's too late?
Great. Thank you so much for sharing. That's so important. I'm also in the health space, and so thinking about similar sorts of things. Also in terms of patient compliance and what are the things that people can do now that's really going to make a big difference for them further down the line. For some of the stroke patients that we are working with and designing things for, about a year after having a stroke, that's the most important time to really, make the biggest difference. But it's almost like, not everyone has access to the very top physical therapy and, recuperative therapies that they would need to have. And so what are those things that they can do from home? And it's almost like when you have piano lessons, you may not want to practice every day, but you have to, and restoring that agency. But then there's also the sign where it's upstream and thinking about how can the senses support diagnostics and, understanding that our senses are really a great barometer of human health. Before we have further Alzheimer's symptoms, people start seeing less of the color blue, for example. Olfaction changes. People, who have other sorts of symptoms of dementia prior to seeing any of those things, we can see it in the senses. They can't smell peanut butter as well. And so there's all of these kinds of things that if we can start developing the tools for doctors and clinicians to pay attention to these changes, we can help to get support for patients a lot faster.
So interesting, because I am not in the health space, but I do focus a lot on the social determinants of health, and a lot of that is spatial. And so how are people's environments, whether it's stress or fear or high rates of asthma or, for example, Cancer Alley in New Orleans, Louisiana. And so all of these spaces that come down to the body in terms of the way that people walk through and live in these spaces, I think for me, I utilize design as a way to, as early as possible, work to imagine kind of new worlds, using design as a tool set to do that, as opposed to very much so retroactively trying to constantly band-aid the issues. And so it's interesting, I feel like from both of you, it's a sense of how do we address the root causes of challenges and utilize what is out there that hasn't been utilized to imagine new futures. And I'm taking it from a more societal scale level, but still on the individual perspective.
That's wonderful. It occurs to me how all of our work is with humans and the human body, but all in different capacities and different angles. But another thing that we found we all really share in common is also an approach to equity and really creating designs and solutions and collaborating with communities to really shift the balances so that everyone has that much needed opportunity to attain, whether it's rights or healthcare or access. What does that mean for either of you and both of you in your work? Start.
Hello. Okay, great. Equity is at the core of the reason why I think that design makes sense in government in the first place. The reason why I say that is I grew up in Harlem, New York, in a building that now still has an F rating, even though it's been 30 years, and nothing has changed. And having grown up in that space and then still be in government arenas where conversations are still being had on, well, who do we talk to? How do we reach them? Who do we engage? And discussions and decisions are still being made in city halls that are not relevant to those who are actually the ones experiencing it. I think equity is at the forefront of why I think we need to be addressing, where I went to a thesis defense just earlier today where it's like, I just want to make sure that everyone is okay, period. That not that a select certain amount of people are thriving and that the rest are actually dying or suffering in order for that to happen. And how do we ensure that there's a baseline and using government as a responsible entity to ensure that everyone on this baseline is okay on an individual basis. And you have to take an equity lens to do that, given the systemic racism of this country and how everyone's starting on very, very different playing fields, and utilizing design as a way to kind of work to equate and help to alleviate those challenges. So that's the angle that I'm coming in, but I'm curious for you.
Wonderful.
Yeah, definitely resonate with that. I think working in maternal health is also just rooted in equity, gender equity, also racial equity. Women of color suffer from postpartum depression at higher rates than white women, partially because they experience higher rates of childbirth-related trauma, which is a high risk factor for depression. And unfortunately, we're seeing that those same women are also seeking mental health treatment at lower rates. And so that disparity there is something that we're trying to address through this tool. And I think that's why I'm really drawn to digital health, is because in today's day and age, digital tools can really expand access, especially, over 90% of people have smartphones now. And so having, help in our pockets and being able to really easily have access to women who need the help is really central to our work. So I think it's a really important piece of our work in design. Yeah.
That's great. In my work, I also, have a lot of understanding of, the different disparities, especially for individuals and populations who have been marginalized by the medical care industry. And, a big part of it is that I work in telehealth as well, and understanding how my devices and these instruments can allow people, whether they're in rural areas, whether they don't normally have access, that they can get, the best care possible and available, no matter where they're tuning in from, and that we can also have more of a global perspective to medical care. And so a lot of these censored instruments are able to standardize and add numerical data and values to things that don't currently have any form of standardization. And so this is going to allow a world to collaborate on this medical and design basis more so than, we've been able to previously and more effectively, because we've seen during the pandemic that it can happen. And that's something that I see for the future, and also making a difference in the lives of people that most need it.
It looks like we might have a couple minutes for audience questions, if we'd like to open it up.
Thank you. To CLEMENCE, first of all, I really appreciate the work you're doing. PPD is something that's affected people in my family, and it's a horrible thing, and the more work to combat it, the better. That being said, I just want to confirm that you're doing everything possible in terms of data privacy and security, especially given how legislation is going in this country that's hostile towards women and their bodies. So just wanted to check that.
Yeah, definitely. That's really central to our work. And while I'll be focusing on the design aspect of the tool, our nurture as an organization is working toward meeting all the compliance standards for data privacy, because obviously that's really, really important in healthcare. So while we're using the data to, find the women who are at high risk, we also want to be really careful about protecting their data. So yeah, thank you for bringing that up.
Thank you all. I'm wondering if you guys have any takes on the treatment prevalence paradox, where more people are being treated for depression than ever, but it's also true that rates of depression are increasing faster than they ever have before, and if that also applies to postpartum depression. Thanks.
Yeah. Sorry, so you're saying rates, can you just restate their question? Thank you.
Yeah, definitely. Okay, so more people are being treated for depression than ever, and also rates of depression are rising faster than ever. So wouldn't it be true that if treatment was increasing, rates would go down, or the prevalence of depression would go down? And does that also apply for postpartum depression? Thank you.
Yeah, great question. Thank you for repeating. I think part of it is also that just depression and mental health is luckily being destigmatized. And so I wonder if we're just seeing more people come forward with their symptoms and seeking help. And so that's contributing to the increase of depression, even though we're also seeing more treatment for depression. So I think that's a great thing. And I think that's really central to our work, is like bringing that forward and making sure that we can normalize depression, because it's something that the more we talk about, a lot of mental health is kind of breeds in secrecy, and thrives on secrecy and hiding and isolation. And so the more we can talk about it, I think the better we can treat it.
Alexandra, you had mentioned that people who've had strokes go home with a squeeze ball and not much more. Can you tell us a little bit more about the things that you're developing that people could use to rehabilitate themselves?
Absolutely. Thanks for the question. We are in the process of developing highly censored instruments that also harness the senses so that they can access really more brain regions and engage those really as a way to bridge over the regions of the brain that are not doing so well or have been damaged. And so really targeting that information pathway in the brain, the frontotemporal regions. One of the best ways to access this whole region at once is also through other kinds of senses. And so incorporating aspects of music and design and motion and movement and kinesthesia is so important, because it allows for so much more engagement of these, motor neuron regions, as well as some of these other areas in the brain. And one thing I've always said, some of these devices allow patients to reach for an auditory goal instead of just an arbitrary goal. And what's very exciting is that they also are filled with sensors, and so that doctors can tell exactly how a patient is doing. Telehealth is now stabilized at 38 times higher than before the pandemic, and so this is a part of the new normal. But how can we really harness it so that it is helpful, especially with patients, one can overestimate or underestimate how one is doing, and it's difficult to know, especially when someone might be dealing with hemiplegia or loss of feeling. And so that the patient is getting the biofeedback through this instrument, but also that the doctors are getting the information they need to really support the patient to make everyone's job a little lighter. Yeah.
Great. Thank you so much for your questions. Thank you both for this conversation, and I think we'll hand it off to the next panel.
Yeah.